What causes a scene or an event to be causing traumatic symptoms for one person, but not necessarily for the other, right? So let's talk about this for a minute and see if we can dig into this.
Generally speaking, when I'm working with my first responders, if they encounter a big incident, we'll say it that way, a big incident, I'll tell them monitor yourself for the next 7 days. 7 days go by and you're starting to kind of come around, we might be okay. We might not need to do anything with it. But if 7 days go by and you're still kind of feeling not great about this, or it's affecting you in some way, we know we got to do some work, right? This is huge. So this is, as a therapist, this is what I'm usually after, is I have to figure out for my patients, with their help, of course, I have to figure out what is going on that they were thinking about in that moment of the emergency or after, right? Because that can be a huge contributing factor into what may develop into some problematic symptoms down the road. To give an example of that, let's say that an EMS driver is responding to a scene. But again, I'm going to try not to get too graphic here, but let's say an EMS driver is responding to a scene and it was a kid on a bike that gets hit by it. And they get to the scene and unfortunately the kiddo's gone. Okay, they're already gone. Now, that stuff happens frequently, unfortunately.
But the cognitions that a person might have from that event, such as could we have gotten there faster? Was it my fault? That can cause it to be stuck. And when it ruminates in our subconscious, that tends to cause nightmares and flashbacks and agitation and other symptoms over time.